Please start, ma'am.
A very good morning, dear friends. I am Dr. Jyoti Devan, and it is my extreme privilege to welcome you all to the second day of the international webinar on COVID 19, the strategic route ahead for global action, being organized from the 11th to 13th of June 2020 by the Institute of Management, Commerce and Economics, Sri Ram Swarup Memorial University. This webinar aspires to explore the impact of the pandemic and chart a strategic route to combat the uncertainty, keeping in mind global and local developments of the past 2 months. A cross-section of experts from different walks of life will be addressing the participants on the current scenario and the ways of navigating a route for themselves ahead. The speakers will be addressing various aspects, jobs and businesses, society, health and community, as the world which we knew has been changed forever and ever. We bring for you 3 power-packed days, 6 eloquent speakers, 6 phenomenal ideologies, and 6 countries. Recap of day 1. In the first session, we had Professor Ajay Kapoor, Pro VC Research, Swinburne University, Melbourne, Australia, talking to us about the future of work, the skills needed in the post-COVID-19 world. In the second session today, we had Professor Asiya Chaudhary from the Department of Commerce, Aligarh Muslim University, sharing her views on India getting GLOCAL, a new norm amidst COVID-19. We had a fantastic response from our audience, questions and queries galore. And as we look forward to a thought-provoking day today, as we welcome Professor Dr. Nitin Tripathi, Director, Special Degree Programs, Asian Institute of Technology, Thailand. A little bit about our esteemed speaker. Dr. Tripathi is a professor in the Remote Sensing and Geographical Information Systems in Asian Institute of Technology, Thailand, and has over 32 years experience in teaching, research, and projects. Apart from his regular responsibilities of teaching and research at AIT, he has also served as the leader of Information and Communication Technology and coordinator for the RS and GIS field of study. He has earlier served in various administrative positions in AIT, such as Dean School of Engineering and Technology, Director Academic Quality Assurance and Accreditation, Chairman Academic Development Review Committee, and many other posts of extreme importance. He has to his credit 2 books, 11 chapters, 125 research papers, and 59 conference papers. We are indeed very privileged to have him with us today. Before we welcome our speaker, I'd like to invite our Pro Vice Chancellor and Director, Institute of Management, Commerce and Economics, Dr. Ajay Prakash, to say a few words in welcome.
Thank you, Dr. Jyoti. Honorable Professor Nitin Tripathi ji, Director, Special Degree Program, AIT, Thailand. Honorable Vice Chancellor, Sri Ram Swarup Memorial University, Professor A.K. Singh ji, Dean Management, Professor Mohit Verma, convener of this international webinar, Dr. Jyoti Devan, large number of participants. This is the second day of the 3-day international webinar on COVID-19, the strategic route ahead for global action. And on the second day of this first session, we have an international level speaker, academic leader, and renowned academic administrator of none other than the AIT Thailand, Professor Nitin Tripathi. I really feel grateful for his consent to address in this webinar on very topical theme, that is smart healthcare systems in and post COVID-19 world, which is a very topical theme. And I hope that his deliberation and his knowledge sharing on this topical theme will benefit large number of audience who are connected on the second day of this webinar, and also they will disseminate his ideas to their other colleagues. Uh, Professor Nitin Tripathi ji is very well known academic leader and academic administrator. He has a very distinguished academic career. He is from India, having studied at IIT Kanpur and at several places. Dr. Jyoti Diwan has given his formal introduction. He is very well known in the academic world, and particularly at our university, he has been very well associated with, and he has uh, been giving his consent and cooperation and ideas in many of the forums and places whenever we had needed his advices. So I'm really grateful to Professor Nitin Tripathi for his consent and who has, who will be delivering his thoughts on this very topical theme. I also extend my warm welcome to our Honorable Vice Chancellor, Professor A.K. Singh ji, who is the academic leader and who has always motivated the entire academic colleagues in organizing such webinars, also in this very pandemic outbreak. I also welcome the large number of participants, academicians, industrialists, and the students who have joined today in this webinar. I also like to congratulate the hard work, untiring work of the entire organizing team for organizing this webinar. I hope Professor Nitin Tripathi's ideas will be very much beneficial to all. Thank you very much. Dr. Jyoti.
Thank you very much, sir. Great words from a great leader. And I'd now like to invite our Vice Chancellor, sir, to say a few words of blessings and encouragement and his views on the topic, which he may like to present.
Good morning, everyone. I think I welcome Dr. Nitin Tripathi. We know each other, and we have been taking valuable advices and consulting on very things. I think that the COVID-19 has really thrown many theories, absolutely planning haywire to the whole world. And this subject of a smart healthcare system in and post COVID-19, it is really apt and relevant today. I think the first case which has come in the November 2019, and this 6 months, 7 months, I think the cobweb has started clearing how we should organize our healthcare system. None of the countries, we can say today, this is really ready to combat coronavirus as what it is there today. Whatever we have planned, it has all gone for a 6. Maybe a developed country, underdeveloped country, they are almost the same. The populous country like us, it can be turned into a really disaster. What I want to say is all the disaster management plan which we have, it has never considered any pandemic outbreak, how we are going to deal with it. So I think now onwards, there is a need to really plan our healthcare system, especially see how we are really going to plan it and how we are going to implement it. So this should be a part of disaster management plan. So far, we have dealt disaster management plan, nature made or artificially disasters. And we are able to, after tsunami, we have considered that also, yes, how we are going to do it. Now, the healthcare system on all Asian countries, if you see, it has not come up as what it should be as the growth they have attained. Country like us, healthcare system is still very far from satisfactory. And other Asian countries also, though they have grown, the growth rate is very high, but still the corresponding growth in the healthcare system is not there. Second, how we can plan it? It cannot be planned one day unless there is a government allocation, priority, public-private partnership, hospitals and healthcare systems are there. And one of the major things it has also happened, also we have to more concentrate on prevention rather than cure. Because if we have robust uh, uh, population, I mean, in the sense who are preventive way, we can avoid the death rate. Because any disaster, first and foremost, us we want to survive, and that is the priority. So, at the same time, physical infrastructure needs to be preserved. Your human infrastructure means though uh, it should human resources, it should not incapacitate. We should be able to teach the younger generation, and that is a task which we are coming. We have also seen as a World Bank, I think the government, we have also World Bank countries have pledged that by 2020 we will be able to have a proper healthcare system. I don't think by 2030 we are going to achieve that unless we have a really concentrate money allocation as per that. So my point is that health services are going to play a very important role. How we are going to plan it, and means you cannot avoid disaster, anything, because that is unknown. But how post disaster you can manage it, that is very important. So, minimum requirement of health and services should be first provided, and phase wise, again, it should be augmented. Now, today, most of the hospitals, they have said, okay, they have got no beds. You know, there is a crisis in the army, also, it is planned when the war happens, we augment the health services. Everything, say, suppose it is a 1,000 bedded hospital, they are told to they should be able to absorb 200 beds more. So that capacity has to be developed at each and every level. Primary healthcare system, district hospitals, super specialty hospitals, availability of pharmaceutical support, if, how the testing is to be done, various protocols are there. If you see most of the developed countries also, most of the people also die due to the negligence of medical services. Our hospitals are the ICUs are the biggest, a spread of any virus or bacteria is there. So that also needs to be looked into. Uh, so it requires a lot of effort. It requires a lot of doctors. If you want a 10,000 population, one doctor is to be there, it should be there. It is also important that apart from that, uh, that paramedical staff needs also to be there. Who is going to test it? How is going to be tested? And in that, we have seen many of the countries, they are using like a distribution to COVID patients, especially they are using robots to distribute the medicine, going there, collection of swab and other blood tests, they are able to assist. So this needs to be done. Second, I think you cannot stop virus spreading or something like that. Nobody sees it. It can't be caught and it should be put in the bottle, something like that. It will go. So, to my mind, it is going to stay for 2-3 years. We have to plan accordingly, and also we have to live. But we cannot say be very, very. Also, we should not be so much worried. We be just all the time you are in homebound and you can't. So the country has also to do progress. The people have to work. People has to a study. I think that is the most affected. I think children education or a mid-level education or a higher education, even the research is quite affected. Nobody is working on the lab how it is going to be there. So there is a need to come back to this, and we have to live it with a proper precaution. At the same time, as a smart healthcare system, how it should be there, and post-COVID, how it should be there, how we can augment it. That is very, very important. Information technology has already given a boost. Today, with in India also has developed Arogya Setu, Arogya Kavach, this type of things. So information about the COVID outbreak, the likely places and other things, it can be given. So we have to come up with a solution. Education also, we have to come with some hybrid or a blended model where online teaching and other things. At the same time, we also understand that there are many engineering subjects, medical, pharmacy, architecture. We have to really come to the really place, and it has to be guided. The students are also one of the very today depressed people. I mean, they are 4 months. They are just in a room. They are there. They are not going out. They are under at this time. A campus life they are missing. Their boys, girls, friends they want to meet. They want to laugh. They want to play. This is also very, very important for a nation so that they are properly motivated and the future is secured. With that, I will like to end this. Also, before I say there is a need to also to look into very human aspects have also come up during that. We have seen in India condition like urban slums, migrants, laborers. There is a need to be a policy and has to be looked into. First of all, these slums, how we can avoid that, how we have to alternate plan has to be there. So whatever healthcare system we design, if we don't design for those people, it will all topple everything down. Because after all, today also in our country, we say that the most infected areas are urban slums. So unless we avoid that, how will we plan? So this has human angle. We have also realized that there are people uh, who needs to be looked into. Yeah. Uh, I'm not trying to be something very negative or something, but there needs to be a plan. Need to be a plan to look after this. And healthcare is one of the most important things. You first of all you have to survive, then only you can work. So with that note, I will end my talk, and I think with this conference, many things will come out, and we'll deliberate upon this, and we'll see how we can go ahead. Thank you very much and especially the Institute of Management, Commerce and Economics of Ramsarup Memorial University, and our director, Pro Vice Chancellor, Jyoti Diwan, Mohit Verma, who has organized this and keep it possible. Thank you very much, and thank you, Dr. Nitin Tripathi, once again to be part of this webinar. And we'll continue to get guidance and your talk, whatever the valuable things comes, how will respect. Thank you very much.
Thank you.
Thank you very much, sir, for your eloquent words and guidance. And we are really very inspired to have you with us and with your words of encouragement. I'd now like to invite our session chair, Professor Dr. Nitin Tripathi, Director Special Degree Programs, Asian Institute of Technology, Thailand, to address the session theme, Smart Healthcare Systems in and Post-COVID-19 World. Dr. Tripathi, please.
Yeah, thank you, Dr. Jyoti. Professor A.K. Singh, Vice Chancellor, SRMU, Dr. Verma, Dr. Prakash, for joining today, for inviting me to this webinar. And I am representing Asian Institute of Technology. I'm very happy to be with all the students of SRMU and all the people who are watching the webinar. Thank you for joining today. I will share my screen. I think there is a problem in sharing. Okay. Is it visible? Yeah.
Yes, sir. It's visible, sir.
Yeah. So once again, welcome all of you to the my webinar on smart healthcare in a post COVID-19 world. So all of us are part of the history now, that we are making the history now, that whole society is changing, transforming, and this transformation is going to stay for some time or maybe forever. Now, what is a smart healthcare and how it can face the challenges that COVID 2019 has given to the world, that even after 7 months, the world is under going through all the kind of problems and trying to face it, trying to find strategies how to face this one and save the people. So my content will be, I will just tell the disease status in the world, healthcare status, need of healthcare, smart healthcare, and service and business opportunities that are coming up from this. You can see on the right side, this is a some part of my institute. So I just thought that though all of you could not come to AIT, but at least you can have a glimpse. So I'm sitting in Thailand, almost say 3,000, more than 3,000 kilometer away from you, and still we are talking to each other, we are listening to each other, and also we can interact, share our views. This is also one kind of a smart way of conference. We are saving a lot of money, lot of time in traveling, and still it is the same kind of experience that we are having. Now I will come to the topic. This is a seminar from management school from SRMU, but I have chosen the topic of health because the COVID was there, like how the COVID is going to affect us human beings. And now, so I think health is very important. And of course, the business is only for the society and human beings. So I think health is the pertinent topic to take. So I have taken this topic, smart healthcare. So when we talk about health, it is for human beings. And we can see here on the left side, there are number of elements like say air, soil, food, water, etc. So many layers are there. These all of these things are affecting human health. And in our geographical information system, we make maps, and then we associate these maps with the healthcare, with the accidents, with the disease, everything, and we find out relationship of all these parameters with the health. So that is the thing that I work. So I work on health issues and relate the climate, relate environment, relate socioeconomic feature to the health. And then we find out how to safeguard human beings, how the impacts are there, and how to make policies, how to make strategies to save the human beings from all the adverse effect of environment. Like say climate change is there, and then suddenly heat is increasing, then it will cause health problems. So how to give warning to the people that if this kind of climate is there, this kind of environment, then this kind of disease may occur to you. So this is the thing, it's called health GIS, and I'm working in that for number of years. Now we are all worried about COVID. So if you go to the World Health Organization website, you will see the dashboard, COVID-19 dashboard, and it will tell every day what is the status of COVID in the world. So you can see the map, and now you see the global nature of this disease. So the disease started with China in Wuhan, and then it is spread all over the world. And now USA seems to be the most affected country, and now it is spreading everywhere. Even in India, initially the impact was not much, but after April, mid of April, it started increasing, and now it is looking like going beyond control. So this is the situation. Now we can see around the world, we can see for each country what is the status. And now I go to the next slide. We can see, say, suppose I'm in Thailand, I can know what is the thing, like how many cases are there in Thailand, 17, total number of cases in Thailand, how many deaths have occurred. So this is the situation in Thailand. So you can choose any country and you can know. So why we need this? I think in this era of information technology, everybody wants information. Suppose I have some my people in, say, uh, some country like, say, Netherlands. I like to see what is happening in Netherlands. How many patients are there? How the situation is, it going down or is still rising? So all these things are available in form of maps, in form of information. If we want more detail, like in Thailand, what is the situation, then we can see the daily newspaper Bangkok Post. They are coming out daily records, and you can see same day what was reported in WHO website, it is also reported in Bangkok Post. So Bang means Thai government data is in Bangkok Post and same is there in the WHO. In almost every day they are sharing the data. Now on the right side uh, there is a rank, like Thailand is out of 200 countries, say it is ranking 80. India is almost, say, fifth in the rank now. Earlier it was quite down, but now it is rising, and it is a thing of concern for India. Now Thailand is 80, and you can see here new cases are almost zero. Like for the last 2 days, one or two cases only, and recovery rate is very high. So whatever cases come, they are all getting recovered, and then I think danger is not there in Thailand now. So things are opening up. Now we can see map of Thailand. So now we can see on the map. So there are various provinces of Thailand, and we can see the red color is which is highly affected. So Bangkok city is highly affected. Then south of Thailand, some provinces are highly affected. So you can see, you can go in detail and find information. So when you have this kind of information, then you have confidence that whatever is coming, there is a detailed information, and I can take some decision. If people say Thailand is very safe, no problem, but there may be some patches in Thailand, they are very unsafe, quite unsafe. One should not go in those patches. But there are some provinces which are totally safe, like, say, there are some areas where very less number of cases are there, so we can go there without any problem. So this is the thing that we can do. Now I come to the diseases in the world, which are the top 10 causes of death for the human beings in the world. So this is the thing for per 100,000 population. So heart disease, ischemic heart disease, which is because of artery blockage, the disease of heart occurs, that is like very high rate of death, like, say, almost 120 people per 100,000 die. Stroke is another, that is heart stroke. Then respiratory infections, and then pulmonary, chronic obstructive pulmonary disease, tuberculosis, diarrhea, diabetes, and then so many diseases are there which are causing death, but heart disease is the most severe. Now if I see what are the second number by income level, high income countries, middle income countries, low income countries, if I see, we will see that cardiovascular diseases are major disease in the middle income and low income, where the death is occurring. But in high income countries, now the cardiovascular disease is not the highest threat. It is the cancer which has come out to be the highest threat. So cancer is one thing which is causing problem in the high income countries. It means they are consuming something, or they are not taking up care of the things, so that they are going through cancer. Now the map below, you can see here, it is telling death rate per 100,000 population due to diseases. Now you can see here, there are some countries which are dark brown. So these countries are having maximum death. So it means healthcare is not good there. Whereas if you can see US, Australia, etc., Canada, then healthcare system is very good and death rate is very less. It means coping capacity is there, hospitals are good. So like Europe, etc., you see very less death rate. But Africa, some Russia, all these countries, the medical facilities may not be that good. So death rate is very high. So this kind of informations people are now working. They are doing research. We are all into this one, and we try to find out about health issues around the globe. So what our government is talking GLOCAL. I think from the local we have to be connected to the global issues. Now all the global issues are affecting us. So a virus initiated in China, it is affecting India, US, everywhere. So nothing is now local. So we are like G-local. So this G-local was coined by Sony, uh, means CEO, and he told that we can be local, but we have to have global outlook so that we can serve the whole world. And we are all affected in this disease also, and every country is cooperating. Like even the USA wanted medicine from India. You can see that one. And now they are giving us ventilators and everything so that we can take care of our patients. We are giving medicine to China also, and they are supporting us. So I think this is the global world, and local issues are all dealt locally, but we cannot ignore the global nature of these issues. Now, this is the health ranking, means a healthcare security index, where we are. USA is on the topmost, like it is the most secure country for global health. Though pandemic corona it has suffered, but now they have controlled it. You can see India on the global healthcare security index. US is 83.5, then Canada is 75.3, Thailand is 73.2, India is 46.5. It is quite below. In fact, it is at 150 rank out of 200 plus countries. It is at 150 rank. So it is just above some countries in the world. If you see the expenditure on healthcare system, USA is spending almost $10,500 per capita per person. India is spending $209 per person. 50 times more USA is spending. Even if India triples its spending, you will see changes into the healthcare facilities in India. Even if we spend just 3 times whatever we are doing, still we will be much less than South Africa, the next country to us. It means there has to be a significant increase in the healthcare system, extending the healthcare facilities, healthcare system, upgrading our hospitals, upgrading the number of beds. I think we have to do a lot. Now I come to the smart word. It's like a smart community. When the present government came, they wanted to make smart cities, 100 smart cities. But for making 100 smart cities, we should have smart communities first. What is a smart community? What is the smart thing? A smart thing is doing, one should be able to take the most optimum decisions. That is called smart. One can do the maximum in the limited resources. That is smart. So how we can do that one? So we have to make our community smart. It means we have to use the modern technologies like mobile technologies, sensors, and integrate all of these things into the information system, geographic information system, because we are all talking about our cities, our provinces, our countries, and how we can synergize. So we have the people, they are in a particular place, and they are all connected by number of sensors, and then all the information is going to some server and it is converted into knowledge, and then people themselves or administrators, everybody can take decisions. This is called a a smart community. It means the people here should know how to deal with the system, how to use the system. Now, Internet of Things, IoT is a technology which has given big boost to the business. I think IoT gave the complete jump into the industrialization, automation, and it is giving lot of business opportunities. IoT is the collection of several entities, several sensors connected on the network. So we are on the net now. I am all connected to you. You are connected to me, and thousands of people are watching this webinar. They are all sharing my views, and they can share any of the views of the top people around the world and take some knowledge from it and move forward. So this IoT, India is doing very good, but miles to go, and we have to make it more affordable, more implement we have to do. Now, a smartphone, everybody is having a smartphone. It is a tiny little device, just say 5 inches in dimension or even lesser. And this is having lot of apps you can see on the screen. And then each of the app is a great source of information to us. I think in the morning when we get up, the first thing we do after getting fresh, we just take our phone, mobile phone, and try to get some information. We want to see what we have to do today. We have to see the news. Nowadays people are not reading newspaper like paper newspaper, they are reading on the mobile. So this is a great source of making the communities smarter. So it is used for communication, talking to each other, news and information, socializing, gaming, scheduling, and management. So this device has changed our way of thinking, our way of life, the way we do the work. Now, smartphones, sensors, there are more than 20 sensors already in the smartphones now. Some of them which are very common, like say compass, it gives the direction. Orientation sensor, when you make it in different direction, the north direction in your compass will change. Accelerometer, when you are moving, it is taking the location from GPS, and it is also telling by which speed you are running, whatever you are doing, those sensors are there. Global positioning system, there are so many 140 satellites in the universe from which we get our locations. From GPS there are 30 satellites. And then voice and noise, like the amount of noise around us, so our microphone can take the noise and it can tell what is the level of noise. Then light sensor, we can have a torch in our mobile phone. Magnetic sensor, it is also telling like electromagnetic radiation it can sense. Then camera, it already has camera which is widely used. Then wireless environment, it is all connected anywhere we are, by Bluetooth, by wireless, we are connected to by Wi-Fi, we are connected to the world. So this is all connected. So this tiny device is making us all smart. Now, what are other sensors like touch screen? Now, you touch the iPhone screen or any smartphone, it can do certain things. Like you can select an app. You touch little 2 times, then it will do something else. You touch little bit more, with more force, it will do something else. So different kind of like touch screen sensors are there. Pedometer sensors, speed, fingerprint sensor, just to enter instead of password or etc. You can use fingerprint. Biometric is there like eye sensor. So now face recognition is there. Now iPhone can open just by face recognition, no need of code. Barcode sensor is there, QR code reader is there, barometer, like if you can go on different elevation, it will tell you the height. Heart rate sensor is there. So you just put the camera on your finger and there is an app, you can find out your heart rate. Similarly, temperature is there, it is getting the temperature record. Air humidity sensor is there in Galaxy S4. Geiger counter like radiation sensor is there. So much data is being sensed, and all the programs are using this data. And what they are doing, they are taking the data from your mobile, they are putting it on the cloud. data on the cloud. So some data has to be stored because iPhone or smartphone doesn't have too much of storage. So data is on the cloud. So from our iPhone, etc., or smartphone, the data is already going to the different clouds. And then we are doing monitoring in the office, hospital monitoring, home monitoring, on the road monitoring. We are administering our office, our business, and doctor on duty doctor is using it to see the patients. So you can see here that so many sensors are there in our device, and it is making us smart. Now wearable sensors for healthcare. Now you have seen people are using like smartwatches to see how much they have walked every day, like 8,000 steps they have to walk to keep themselves fit, how much they have done today. If not, they will go in the night also and walk. So these things are there. Then there is a whole lot of sensors around it, like say EEG, ECG sensors, ECG like our heart health, it will find out. Then wearable watches, they have lot of things, wrist and pulse and blood pressure, plantar pressure, human motion, EMG signal, blood oxygen, our diabetes surveillance like glucose, temperature and hydration, muscle movement. All these sensors are there. And from all these sensors, the data through our mobile or our smartwatch, it goes to the cloud, and then data is analyzed and it goes to the hospital or the doctors directly, and they can know our vital signals, and they can give us, like say, what is happening to us, is there any cause of concern, and they, before we know, doctor can give us the warning just because of our sensors. Now you can see here, wearable healthcare devices are measuring our sugar, glucose level. They are measuring different activities that we are doing, like where we are running, how much we have run, what was the speed at different times, how much calorie we have burned, how, what is our weight if we put it. We can also regulate our weight, medication, how much medication we are taking, whether we have taken or not, what is the kind of nutrition we need and how much we have taken. Then there are so many companies which are producing these devices. Even Google Glasses have come now with some device. They are all connected to the computer or cloud by Bluetooth, by Wi-Fi, or by LAN. And then these are giving the patient health record in real time to the doctors. Now here, some work we have done in AIT. One of my PhD students, now she's in USA working in a company, Priyanka Kakria, and one of the heart surgeon in one of hospital in Thailand, Dr. Pirapong. So we guided her to develop sensor and a smartphone system for real-time heart monitoring, alarming and reporting system. I will not go in the detail because time is not there, but the whole thing was developed by us in AIT. We have taken the sensors, we have taken the mobile phone and developed the programs to connect all the sensors, and then take the data to the cloud, analyze it. Location is also there. So even the old people are there, wherever they are, we can put the sensor to them. Even if they in their home, we can monitor them from remote. Even if they are in India, we can monitor them from Thailand or anywhere. So these old people, they don't have to go to the doctor every day. Whenever things are there, it can be monitored. If there is something serious, immediately the hospital can send them, like say, uh, ambulance, and bring them to the hospital for proper care. So doctors, patient, where they are walking, they are just in their home, they are all connected together. So it is a giving lot of confidence to the patient, to the doctor, that they don't have to really meet each other every day, but they are all connected every time. Now, when we are running, we want to have the sensors on our arm, and then it will record all our parameters, and we can take care, like how much speed we are running today, how much calorie we burn, how much time we have ran, and this is the system. So we have tested it on number of student faculty in our AIT, and then made sure. So you can see here, there is a Arduino board, and then we can put it, and this Arduino board will connect all the devices. So these are the devices that we have, like blood oxygen. Then we have, like say, temperature. We have ECG, and then we have blood pressure monitor. So all these things are through Android phone. They are connected by Arduino board, and then this is the wrist sensor just giving the pulse rate, and then these sensors are going to the mobile interface, and then going to the server, and then blood pressure, heartbeat, calories, distance covered, location, everything is calculated. And then we have some smart program inside. So it will send the data to the doctor's mobile, doctor's tablet, or his computer. He can see anywhere. And even if he's in a car, he can just watch his patient who is performing what kind, is there any problem, and he can connect to the patient also. So you can see by Bluetooth, signals are going from mobile and sensors to the cloud, to the server, and then it is processed. So these are the sensors. They will be connected to the like Bluetooth, etc. by Bluetooth Arduino board. And this has been all collected from various sources, these sensors. And then we have connected it through Arduino to our mobile. And then through wireless LAN, we can send it to the server anywhere in the cloud, and doctors can see the record. So a doctor doesn't have to see only say 100 patients any day. He can see thousands and thousand patients. They are all connected, and he can just spend few seconds to see how what are the parameters of different patient. And even there is a program that we have written to give him the alert, like he doesn't have to analyze all patient. So he can choose any patient who's not performing well, and he can see all the data about them, everyday data. We can program it like you take the signals like 3 times a day, all the data, and then serve it on the cloud. So this can be done. This our PhD student has already done. And it can also come in the graph. No need to read the numbers. So what is the, like say, heart rate? What is the blood oxygen level? What is the body temperature? What is the blood pressure? Everything can be monitored. Now this is the ECG record. When a person is having some kind of say blockage, etc. in the heart, and he's having chest pain, heart pain, then ECG record is very good. And this is not a common part of all the healthcare devices, but now we have got one sensor, and we have also connected it to our system. So thresholding ECG values. So I was working with a heart specialist, and we have written a program how to give alerts to the doctor. So he doesn't have to see all the graphs and spend like say 10 minutes to understand that. So we can just give the critical ECGs to him and give the alert, and then he can go in detail to study that one. So these are the things, and I will not go in detail. And wherever there is an alert needed, it will be given for a particular patient to the doctor, and then doctor will go in detail in the record, and he will contact the patient. If there is really serious thing, then he will immediately get him to the nearest hospital or ICU. A lot of comments are also coming, but I think I will take them at the end. And so you can directly talk to me at the end. Right now, I will continue with my presentation. So wearable technology market. Now I come to the, like say, business angle. Like all these technologies are there, but these are to be manufactured, these are to be tested, these are to be taken to the people. And who will do that one? There will be, of course, like industries, management people, supply chain people, marketing people, all of them are involved into this one. So this, who are the world's biggest wearable technology buyers? If you see the world, you'll see the USA is the biggest technology buyer of wearable sensors. Then comes Europe, Russia, China, Saudi Arabia, Australia, India, Thailand, and Southeast Asian countries, some African like South Africa, then South America. So these are the countries where a lot of people are buying the technology. 5 top wearable device solution impacting the healthcare industry. So all of them you can see are in US or mostly in the Europe. So they are all making different top devices, and top companies are there. And so 5 out of 598 wearable device solutions are disrupting the healthcare industry. It means we can say they are transforming the healthcare industry. They are giving more information to the healthcare industry to become smarter. Now, these are the so many companies have come up, like Fitbit. I think many of you may be having the watches from Fitbit. And then uh, there are so many companies you can see here: iHealth, Moves, Omron. Omron is producing blood pressure monitors, then calorie counters. So many companies are there which are producing healthcare industry. They are healthcare industries. They were a startup. Now they are doing very good business. Now, smart healthcare systems. Now, from the wearable devices, I come to the whole system. What is the healthcare system? Nowadays, our hospitals are becoming smarter. The progress is very fast in some countries. Some countries are still traditional, but government has to take care. Like when the patient comes, the nurse will meet them, admit them, and then everything like say telemedicine is there, remote patient monitoring is there. So even the patient can go home or some other country, they will be monitored by these hospital. Telemedicine support is there, so doctors will talk to the patient whenever the patient want, from anywhere. No need to go to the hospital until unless it is really needed. And then artificial intelligence, machine learning, they're all slowly coming into smart healthcare system. So a lot of technology intrusion is there, and which is making the whole healthcare system very smart. Now I come in India. What is the situation? I will not be able to give a complete picture, but I have taken Apollo Hospital, and it is a common service center telemedicine Apollo Hospital. I think some of you might have seen there, and they have very good interface. And so a patient walks into the CSC center, patient health information is collected by the means BLE and sent to the doctor. So it is recorded, initially registered like that, and then all the parameters are recorded and sent to the doctor. Then Apollo doctor reviews the health information provided by the patient. Then they are connected to the patient and doctor for consultation through video. So first all the parameters, and then through video the doctor is seeing the patient, and then all he gives his advice, treatment and prescription, and it is given to the patient, or it is given to the pharmacy, and medicine is sent to the patient. This is called complete telemedicine interface, which is coming. And in fact, it is the contribution of telemedicine is increasing day by day. So physical meeting with the doctor is now becoming rare, until unless it is really necessary, because number of patients are becoming more, population is becoming more, and everybody wants to see the most expert doctor. Like if somebody is a heart patient, he like to see the escort doctor with whom he has consulted or he has gone through some operation. So that doctor can use telemedicine and connect to the patient. Now Apollo Hospital digital healthcare, it is called digital made Mantra. It is a comprehensive next generation hospital information system. It is enabling patient centric healthcare, complete digital administration, patient care, clinical care, ancillary services, ease of access to the patient records, and complete electronic medical record is there. Now I come to the Thailand. Samit Vej Virtual Hospital. It is one of the top hospital here in Thailand. They have virtual hospital. Like suppose somebody gets up in the morning or anytime he has some problem, he can just visit this hospital on his computer. He can get teleconsultation. If he needs some, like say, thing, delivery like medicine, they can arrange. They can also send some people to take the, like say, blood sample or whatever, and then test him. So I think patient doesn't have to move. So this kind of services are very good for the busy people, for the people who are very far away from that hospital of their choice, for the elderly people, ladies, pregnant ladies. All these things are very good. And this is a very good interface. Like it will greet you, it will talk to you, and then you can choose the language you want, like English, Thai, any language. Now another big hospital, which is people say that it is Asia's number one accredited hospital, Bamrungrad, and they have a Dr. Raksha. This name sounds familiar to all of us, but this is a Dr. Raksha, and then this is complete app-based mobile solution for the healthcare. So Bamrungrad Hospital has the presence in many countries. Thailand is the head office, but in like Malaysia, even I've seen in Mongolia, they have Bamrungrad. So all of them are connected by this app, and then consultation, diagnosis, prescription of medicine, follow up, everything is going on online. Now I come to Lucknow, from where most of the participants are. This is a portal that you can find out on internet. Like suppose there is a patient and you want to arrange some patient care services. Nowadays, this is a big issue. Children are working some other cities, parents are in some other cities, and they are all worried how to take care of the parents. So they can arrange caregivers who can take care of the health of the parents. There are a number of services like elderly care, post-surgical care, disabled care, physiotherapy care. So many type of care is there. So you have to choose that one. Then they will connect you to the proper facilities, and just you see there are a number of facilities available in Lucknow. Earlier, just 3 years back, I know it was not much, only one or two. Now we can see lot of facilities are available, and down below you can see on Google, you can just type like nursing and healthcare facilities. Just near to my home, I can find out many facilities. These are not hospitals, these are just healthcare service providers, nursing homes, and like senior care. So you can find out, you can just click them and you can go to the website, or you can talk to them on phone, and immediately you can arrange the patient care, elderly care. So why I'm talking about that, slowly all around us the world is becoming smart. Only thing is how fast we become, how fast we adopt the technology, how fast we get benefited from it. We don't have to complain that things are very bad. No, there are people who are doing it, more people are required to do it. There is a huge job opportunities, there is a huge business opportunities in this, because people need it. There is a huge demand. Now medicine online. Sometimes you need medicine, like in COVID time, you cannot go to the like medical shop, and you need the medicine. There is an app. I think all our young generation student, they are much more familiar with these things. You can just go to the app, download the app from the like say Google Play. All these apps are available. The one I'm talking, Farm Easy, is one of the top app in the India. And then you can immediately choose the medicine. They are giving some deal on some medicines or some kind of say nutrition things material. You can buy that and they will deliver it to your home. You don't have to go anywhere. It was a big thing, like a patient is there and there is nobody to get the medicine, but now he himself can operate the mobile and then he can order the medicine. It looks like a boon. It is a blessing, like, but the technology, IoT, IT, mobile signals, 4G, these all have made possible these things. Very useful. How to order medicine, how to order a person to come to the house and take the blood sample, urine sample for testing from the diagnostic center. Everything is on your mobile. So you are smart. Now, when I was searching how many small like startups are there, service startups, I was amazed. These are all available near to you. These service startups are in India. They are taking care. Their apps are there. So if you want hospital job, nurses job, career, nursing home career, elderly care, everything is there. You want geriatric care, people are having their app, they provide services, and then nobody is having a problem. So healthcare service providers, these are available on Google Play, Apple Store, internet. So elderly care, home patient, dementia care, nursing services, all are available. It's a huge business opportunities. Now people say there will be no jobs will be gone. I do not agree with that. Yeah, jobs are not there for uneducated people. Only limited job will be there. But those people who are IT savvy, those who know how to use the mobile, they can find the job immediately. There is a lot of demand for everything. At the end of the day, we have to do the work by our hand. We have to give care to the people. But if we are a service provider, I can get a job. If I want to make a company and get 10 service provider, I can make a company. So all the elder people will have a caregiver to them. They have money. They want somebody to take care of them. So these things are there. I think our young generation can think in this line, think more innovative, and create more apps of the kind of demand is there. Like say, old people want to pay their bills. Who can go to the different places to pay their bills? So there can be one app. They can just connect by to on that app and say subscribe to that one, and those people can do all the manual work for them. Now I come to the COVID, from where this webinar started and how we are connected. I'm sure if it was not Corona, we would have never come like this to address you, to talk to you using this kind of device. So Corona has also made us smart. I'm sitting right in my home and I'm talking to the people around the world from Lucknow, my own city. And then I can see here how the things are going on in India. In fact, every day, every moment I'm connected to India, what is happening there? I see the Times of India, how many Corona cases today and everything. How our frontline workers are fighting. You can see here, our frontline workers in full PPE, they are going to the field to the patient to test the patient and bring them to the hospital so that this corona spread can be controlled. There are testing going on in the small towns, every nook and corner in India. People are cooperating. You see, if she's not having a mask, she's covering her nose. You can see here, people say that people are not following rules and regulations, social distancing, but educated do follow. Educated people are following it. So some shops are closed. Whoever is open, they have made the places like where people can stand, maintain like 1.5 meter to 2 meter distance, and buy the things, and then go away. So they are all putting mask. They are following social distancing. So these are the good practices. This is the bad practice. Even though lockdown is there in India, but some people don't follow that. They think their small thing is so important and they violate it. And they sometimes chase the policemen also and fight. So this is also happening. And that is why the corona cases could not be controlled in certain part of our country. Now, some example from Thailand. You can see here how the people are disciplined. Even in the like monastery, temples, monk have taken the duties. When the visitors come, they are taking their vitals temperature. If it is more than 37.5, they will not allow them inside the temple. They will take their mobile and they will tell them to scan a QR code and enter and come back in 1 hour. In shopping malls, people are allowed for 2 hours. You can see on the right side, he is the Prime Minister of Thailand. He's a military man. He's a Prime Minister of Thailand, and he himself cooperates. So whenever he goes for a meeting, at the entrance, somebody will check his temperature, and then he will go inside. So everybody cooperates. At every junction, police people are there, and they randomly checking everybody that whether they are having a mask, whether their temperature is okay or not, and testing is going on continuously. There are some test centers, samples are taken, they are sent for testing, and like India, there is also app. Now I come to one of the fantastic app that government of India has developed. It is called Arogya Setu. Fantastic app. Now everybody has to download it in India. They will have all information about like corona. There is nothing secret. Where are doctors, where to get for testing, go for testing, and if some patient is there, if they are coming near to you, you will get an alert. That's amazing. So your location is there, location of the patient will also be there, and wherever the like those targets patient are there, if they are moving, it will be given alert to you, because those patients are told not to mix with the population. So if everybody takes Arogya Setu, implements it in their mobile and follow it, I think social distancing can be maintained and a lot of people can save themselves from the corona. High time to follow it. High time to means adopt the technology and become smart. And if I'm not worried about myself, at least I should be worried for my family members that I should not spread corona to them. Now this is the final slide I'm coming. Future healthcare post COVID 2019. What the world will be. Professor Singh, Vice Chancellor, has given a lot of idea and visions how the world is going to transform. I'm just limiting myself to the healthcare. More and more people are going to adopt mobile-based smart healthcare systems now. It is going to happen in USA, in Europe, Japan, Thailand, China. Everybody is following it. In India, now everybody will follow. I'm pretty sure those who are having mobile in some sense or other, they will adopt a smart healthcare system. Telemedicine for remote patient will become a new normal. Government cannot provide healthcare in small villages, in remote places. They have to provide telemedicine now. They have to strengthen it. We are going for 5G, and I'm sure telemedicine should be on the top of agenda. We have to provide to each villager, link them by the telemedicine, give them the best healthcare by the experts. We can do it. Health aware generation, our new generation from the basic class 2 onwards, they should be health aware. How to take care of nutrition, how to take care of their exercise, how to make them stronger, how to develop immunity, and in the case of say disease, how to use the apps, telemedicine, or find out doctors or medicine for themselves. They should be health aware generation. Social distancing without compromising health issues should be the norm and will be the norm in the future. You will see it everywhere in the world. Now they are not shaking hands. They are just doing namaste, or in Thailand we call it Y. They are doing like this. In this, we are not shaking hand. No infection can transmit from other person, because in our hand lot of infection comes. We are touching many things. We are touching our eyes, mouth, everything. So no need to shake hand. Just do namaste or Y. That is the new normal. And maintain social distancing. Reaching anyone anywhere to provide healthcare. Now with mobile, you can reach anyone anywhere to provide healthcare. Need for manufacturing low cost but efficient medical devices. Now this is a big industry and it has to catch up in India to produce medical devices, electronic medical devices, support devices to the patient, medical beds, and oxygen equipments, so many things. There are so many medical devices, and this industry is going to grow, I think, billions and billions dollar into the coming future. Huge demand, huge business opportunities for smart healthcare. The whole healthcare services and industry is going to change. Huge demand is coming and huge business opportunities. People talk that economy will go down. No, it is going to rise. I think India will touch 10% economic growth. You'll see in coming 2 years. Lot of opportunities are coming up just from health itself. Diagnostic services, they are going to get a boom because everybody will like to test themselves for diabetes, for blood, for everything. So these diagnostic centers are going to boom now. And they will boom not only because they have facilities, but they are all well connected by mobile to their patients, their customers. Pharmacy, medicine delivery. So many medicine shops are there. Now you don't have to open a medicine shop. You just be virtual medicine shop. Right now, any of the student who is listening to me, they can start a business, virtual medicine shop. No need to have physical, and supply the medicine to the patients in their home, wherever they are. Suppose somebody is just taking, is driving and he's getting sick, and then he needs a medicine. So nearest medicine provider can reach him fast and give the medicine. Healthcare provider services, as I discussed already, there are many healthcare provider services coming up. Diagnostic centers are going to boom. Pharmacy, it is going to boom. Tremendous health related logistic and supply chain opportunities. This is a global. Things are coming from different countries. Things are coming from one province to another. Lot of logistics companies, delivery companies. Now in Corona, you have seen delivery system has taken a transformation. You want to order food, you want to order vegetables, grocery, anything. Lot of delivery companies have boomed. So I think this is another area which is going to get a lot of business. Logistics, supply chain, all these things. Now the final word that I think that we can take from this talk is smart healthcare services at optimum cost 24 by 7 is the key. We have to provide 24 hours, 7 days a week, optimum healthcare, a smart way to the people. Thank you very much. With this, I stop my talk. Thank you. Over to Dr. Jyoti. Dr. Jyoti?
Thank you very much, sir.
Thank you.
Thank you very much, sir, for the excellent presentation and explaining to us so clearly about the smart healthcare systems. You have woven together so much information in this short time that I am sure your talk will enrich all our attendees. Your talk has helped us to understand how these systems can build conveniences in the health sector and also aid in containing the pandemic. And especially, I enjoyed and learned from your tips on employment and entrepreneurship and how you have clearly demarcated the upcoming sunrise areas. I'm sure they will be very useful, sir. Just a few questions, although many
Yeah.
questions have been posted. I would like to address some questions to you. What
Yeah.
can be the very business opportunities for Indian diagnostic companies, sir? Mr. Amit Sinha wants to know from you.
Thank you, Mr. Amit. Uh, there are many diagnostic centers coming up, but it's still not enough in India. And people, when go to the diagnostic center, they have to sit there hours. And you can imagine a patient, how can he sit for hours? So the patient can, the diagnostic center can have an app, and then patient can log in into the app and then book that, okay, my blood samples are to be taken this time, and then diagnostic center will send the people to collect the blood sample, and then it will be tested and report can be sent to the patient by online, by app only, and the complete record will be on the app. So the patient can immediately send it to the doctor, share with the doctor. So doctor, patient, diagnostic center, all are connected together. I think this service is going to take a revolution by the smart systems now.
Thank you very much, sir. I request Anushri to kindly post the next question. It is by Mohsin Beg. Mohsin Beg wants to know, sir, as you mentioned above about smart healthcare systems, mobile based, how our government will ensure that our data is protected. He's concerned about the data protection and privacy.
Hello, can I answer now?
Yes, sir.
Yeah, yeah. This is a big issue. Data should be encrypted. Data should be one to one. It should not be shared by everybody. So when the doctor is taking an oath, he also tells that he is not going to tell about the patient to other people. So there is a medical ethics, and all these things are to be there in the software. So I think there has to be a cyber security and some agencies which will guarantee that the system which is being used by this diagnostic center or by this hospital is protected. So it will not be shared by to anybody. This is a very important issue. Like I do research on cancer, so I had to fill a lot of forms, and then I get the data for my information system, and I give a thing that I will not use the name. I just take the numbers of patient of different kind in different locations. That's it. I can take their age, gender, but I will never take their house address or name. This is very secret and it should be protected, and this is not a very difficult thing. So I think in the system there is an encryption, and then data will be protected, and only the patient and the doctor will know the thing. Other people cannot, apart from the system manager, cannot hack the data. I think there can be a protection.
Sir, our next question is from Assam, where Banashri Devi wants to know that, sir,
Yeah.
internet facility is very poor in many of our villages back here in Assam. How can the village people avail the benefits of online medication when internet connectivity is not convenient enough?
Yeah, Vanashri, I really appreciate your question. This is a real problem in our many of the villages. Although some villages near the big cities are having good connection, but I think government is committed now. They are talking about e-banking, business online. I think this is the thing that every government will do now. Now they are able to take electricity. You can imagine that before 2014 there was not electricity also in the villages. Now it has happened. Every village, almost every village has electricity. They have cooking gas. So internet will be the next thing which will happen to you. If it is not there, youth like you must come forward and they must ask for it. We are all paying income tax. So we can ask for like 5G facility should be extended to village level, and then only it will be possible. Otherwise, a smart system will never be able to implement.
Thank you very much, sir. Sir, you are such a treasure house of knowledge that I think we can go on asking you questions and learning from you. As you will see online, lots and lots of questions have been posted from different parts of India and the world. However, with your permission, we'd like to conclude the session for today. And we do hope that we will have your consent to join us at later periods of time to talk to us, to teach us, so we can learn from you. Sir, with
Yes.
your permission, I'd like to invite the Dean of Management, Dr. Mohit Verma, to propose a vote of thanks to you, sir.
Thank you. Thank you, Jyoti. Thank you very much to all the audience. Thank you very much.
Dr. Mohit Verma, sir, I request you to kindly propose the vote of thanks to Dr. Nitin Tripathi.
Okay. Thanks, Dr. Jyoti. Honorable Vice Chancellor Professor A.K. Singh Sir, Vice Chancellor and Director AMC and Student Professor Prakash Sir, Professor Dr. Nitin Tripathi from AI Thailand, and all the connected and registered participants to this webinar second day. First, good afternoon to each and everyone, and good namaskar. It is my privilege to give a vote of thanks in the first session of the second day of this international webinar on behalf of Institute of Management, Commerce and Economics, SRMU India. I extend a very hearty vote of thanks to Professor Nitin Tripathi from AIT Thailand. Professor Tripathi, thank you so much for accepting our invitation to be part of this international webinar and taking out time from a busy schedule and sharing your insightful thoughts today. Sir, it was a very effective and informative deliberation. We all are very much inspired by your great words. Sir, you have rightly pointed out that we need to look how COVID-19 has created unprecedented health crisis around the globe. You have also rightly mentioned that priorities of the policymakers should be shifted to the healthcare management systems. Today's systems need to be evolved, and lessons should be learned from the and they are likely to have a significant impact on the subsequent volume of healthcare across the globe. You have also pointed out, sir, very rightly, you have used the case of CSC telemedicines of Apollo Hospital. We have talked about the smart healthcare system by the means of nurse alert mobile app, telemedicine, artificial intelligence. We have also rightly mentioned the example of Dr. Raksha from Bamboo Gred Hospital online, and future of healthcare system too. Thank you so much, sir, once again for your excellent presentation today, and we look forward for more association with you and your university in near future, sir. Thanks a lot. Thank you so much,
Thank
sir.
you very
Over
much.
to Jyoti,
Thank you,
ma'am.
Mohit. Thank you, Dr. Jyoti. It
Sir,
was a
thank you
nice
so much,
opportunity
sir,
for me.
for being with us,
And
for
sir,
attending your precious
your
time.
presentation deserves lot of COVID applauses also. These are the words we are
Oh.
using nowadays.
Thank you. Thank you. Thank you so much.
Thank you very much, sir. Have a nice day,
Sir.
and we look forward to seeing you again soon.
Thank you.
On
Thank you,
behalf
Dr.
of all of us from SRMU, thank you.
Thank you. Thank you, all of you. God bless.
Thanks. So that was the close of an excellent session, but there is much more coming up ahead. We have with us our next speaker for the day, Ms. Meghavi Banerjee. Welcome, ma'am. Ms. Meghavi Banerjee. Ma'am, welcome. It is indeed.
Hi, good afternoon. I hope you are able to hear me well.
Yes, yes, ma'am. Yes, we
Okay,
can hear
perfect.
you.
Um, it is my privilege to have been following Professor Tripathi, and there is so much that I learned. And I remember during my management education, I was following the case study of Bumrungrad and all of these hospitals. So it was like going back on our memory lane. So thank you very much for having me today. And if you permit me, I would like to start my presentation.
Ma'am, ma'am, I just request you. Your connection is a little unstable, so voice is not very clear. May I request you to just check your connection? In the meanwhile, I'll just read out your introduction. It'll
All
just
right.
so that people know you. And I request that you may just recheck your connection before you begin your presentation. The visual is absolutely clear, but the voice is breaking a bit, ma'am. So it is our proud privilege to welcome amongst us Ms. Meghavi Banerjee, Partner and Head Strategic Alliance, Lincoln University of Business Management, UAE. Ma'am will be addressing a session on learning and continuing education at all times. A little bit about our prestigious speaker. Meghavi currently serves as Strategic Alliances Head and Partner at Lincoln University of Business and Management, UAE, a young and dynamic organization involved in conducting and promoting executive learning. She is also the Chief of Marketing and Alliances for St. John University, UK, for the Middle East region. Medhavi has been associated with several organizations in India and abroad, like Safe Express, H&R Johnson, and Henkel India in business development functions. She has also been associated with educational institutions like the SP Jain School of Management and the Institute of Management Technology, UAE. So now we're all waiting in anticipation for Meghavi ji to join in and present her views. She is already with us, just that there was poor voice connectivity. So she is just reviewing her connection before we begin. In the meanwhile, I'd like to invite the Dean to say a few words, Dr. Mohit Verma. If you'd like to share your views. Okay.
Okay, thank you, Dr. Jyoti. On behalf of Institute of Management and Economics, Shri Ram Sarup Memorial University, Lucknow, India, I heartily welcome Ms. Meghavi Banerjee for today's second session of today's second day of international webinar. Thank you so much for accepting our invitation, Meghavi.
My
You have been
pleasure.
kind enough, and I'm sure, I'm sure your presentation will definitely give lots of leads and inputs to the participants who have joined in India and abroad. So, without wasting more time,
Mhm.
just over to you. You can
Sure,
start your session. Thank you so much.
sure. Dr. Jyoti, can I just confirm, am I better and is
Yes, ma'am.
it
Yes, ma'am. It's
audible now?
perfect now. It's
All right.
perfect. Please continue. And we look forward to your session. Thank you so
Thank
much.
you very much. Thank you. Hi, good afternoon, everyone. Um, I would like to say that it is a pleasure that we all are meeting and we are kind of learning from one another. And I think it is only this continued learning and exchange of ideas, scenarios that is constantly helping us to stay connected and to understand and learn from each other. Well, mine is not from a more educative perspective. It is more like a case study about my own organization and how we continued our business because I also am a partner with this organization, and obviously, as a stakeholder, uh, our always our concern is how to survive and then how to thrive. So the topic that I proposed to Dr. Mohit was learning and continuing education at all times. Obviously, no matter what happens, we as human beings and individuals, we constantly learn either from our mistakes or from our experiences, and that is what my focus. Because our business is also into education. That's the reason why I chose this topic. And already, as Dr. Jyoti has introduced me, I am head of strategy and alliance at Lincoln University of Business and Management. Though we call it Lincoln University, it is more like an institute. So our setup is kind of small. And please do not try and visualize a huge, SRMU kind of a structure in your don't try to mind map us as a huge university. And yes, our origin is UAE. A little bit about me. I'm sure when you see this place, you will instantly be able to identify this place. And this is a real picture of the place where I come from, and that is Mumbai. Mumbai is a typical dicotyledonous city. You will find high rises, and you will also simultaneously find really low income residential places. And this is my city. And I always say that we are ourselves, not just because of the traits that we have, but also everything around us tends to influence us and shapes us and molds us continuously. Dr. Jyoti has already mentioned I have completed my Bachelor's of Commerce and Master's of Business Administration from Janki Devi Bajaj Institute of Management Studies in Mumbai. And after that, I have taken up several business development roles, right from logistics and supply chain company, that is Safe Express in India. Then I moved on to H&R Johnson, which is more of a construction company. And after that, I joined a German FMCG giant, Henkel, and I was looking after the business development of Schwarzkopf. It's a hair care brand competing with L'Oreal. So I worked and I managed the west of India. So largely it was Mumbai and Gujarat. So I had a sales team, I had distributor network, and so my role was completely into business development activities. Now, as life has it, obviously after marriage, I joined my husband and I moved to from Bombay to Dubai. Obviously, one side of Arabian Sea to the other side of Arabian Sea, and the best part is the names rhyme, Mumbai and Dubai. So I didn't just move from one place to another. The place has its own challenges, and as individuals, how we constantly adapt ourselves. I was pushed into education. I always keep telling this that I did not choose education as an industry, but education happened to me. So in Dubai, I'm sure Dr. Mohit will agree with me because he's been my colleague at IMT, where we work together. Um, it was more of a requirement to have a driving license. So as if I was applying for a driver's job. At most of the interviews that I went, that was the requirement. So the place also shapes us in and helps us and pushes us in taking certain decisions. So my sole purpose for joining SP Gen, besides that, it is a very good employer, and I would get a lot to learn. One of my major consideration was that there was a transport provided for me. So that is how education happened to me. I learned a lot, uh, obviously because I came from corporates. I had to leave that behind and carry my learnings and apply it to understanding education operations, what was required, because academics in a lot of ways is still disconnected from corporate. So I learned how things work in academic sector, and then I moved on to join IMT. IMT again, I played more of a corporate role where I was assisting students in providing them with internship opportunities. And I was heading the Office of Career Services. I was helping them in, how to crack job interviews, in their communication skills, and helping them get to the final levels of their job placements. So that's where I learned a lot about the education business as a whole. This is a landscape of how the education sector looks like. Not rather Dubai as an education landscape, but this is more about UAE. And you will find that there are different authorities that manage the public and the private education sector in UAE. Obviously, there are relevant authorities like Ministry of Education, KHDA. There are different authorities who manage different parts of within the education. So obviously, from school to higher education to vocational education, it is managed by different authorities. There are more than 150 institutions you will find in the UAE, which are like you will find New York University, you'll find INSEAD of France, you'll find London Business School having a presence here, IE Business School, which has consistently been amongst the top three over the last 3 to 4 years in FT rankings. SP Gens, obviously, these are more Indian names. You'll find Amities. And obviously, there are local universities like Zayed universities and higher colleges of technology. Um, that's when the defining moment occurred to us. We identified that there was a huge gap in the market, which was available. So most of these universities, I'm talking about the likes of, which have huge infrastructure, which have huge library, they have staff, they have faculty members full time on their payroll. They considered adult learning as a more tertiary and an add-on income stream. So it was not primarily a lot of focus was given to adult education. It was more like, okay, we have this setup. Let us see how we can utilize the facilities. We can outsource our resources, and we can generate an income stream. So the focus primarily was not laid on adult learning. um, Obviously they use the same set of faculty members. So obviously, um, if I am the organization as well, I have full-time faculty members. I will ensure that they have few number of hours which they're teaching for the younger young learners, as well as the same faculty members are also kind of delivering sessions for the executive students who are coming over towards the weekend. The infrastructure investment of all of these universities or institutions is very, very high. Obviously, UAE is not an inexpensive place. So the investments are really phenomenal to start up. And that's the reason why you will see the repercussions on the fees, which is charged by all of these institutions. um, at any given point in time, you will find higher education for executive learners, executive MBA, and all of these programs starting from somewhere around 80,000 dirhams for the whole program to even 200,000. So you will find HALT Business School and all of these business schools almost going up to 180 to 200,000 dirhams for a 12 to 16 or 18-month MBA program. So obviously, if you do the math and you try and divide, it was already targeting people who were earning over 30,000 dirhams, which is a very, very, good salary. And if anyone was drawing that kind of a salary, it is kind of a tendency that that person would be holding a postgraduate qualification. It's very, very unlikely that a person who was drawing so much did not have a continued education after the bachelor's. So maybe that person would be possessing, if not an MBA, at least a CIPD, a professional qualification, something like a PMP certification. That's why that person would be a specialist in project management, or something like a CFA holder or something like that. So primarily, they already had one postgraduate qualification. So that's when we founded LUBM, and we tried and understand what the gap was, and we prepared our checklist. So our checklist, obviously, we wanted to ensure that we had short courses as well as long-term programs. So anywhere from 3 months to about 18 months courses. We were very clear that we did not want a local certification, a local name on the certification, and that's the reason why our focus was purely international quality. Obviously, when you move to another country, your tastes would change. When I was in India, obviously I preferred Indian brands and I preferred local products. But when you move abroad, instantly you will modify your preferences and you would want to pursue an international qualification, and that's what we had in mind, that we wanted to provide international qualifications to the students. We set our sights on Europe and UK, obviously, because UK is known for their level of education over so many years and centuries. So, and also, if you find UK education system is accepted globally, you will find obviously India, Pakistan, Bangladesh, Sri Lanka are primarily, our education system is similar to what has been offered, and it's similar to UK. You will also find parts in Africa which have British curriculum. So we realized that, and also there are a lot of British schools here in UAE. So we realized that obviously UK education is one of the preferred education, and of course Europe also. We started understanding what would be the best method to come up with something that is, flexible and doable for the adult learners. So we thought of coming up with weekend sessions, and the weekends here in UAE are starts from Thursday evening, all of Friday, and a bit of Saturday as well. Those are our weekends. We also came up with, unlike universities who charge either semester wise or annually, we split our fees into equated monthly installments. We obviously we were seeking out partners, and we had a clear understanding that, with these partners will also come along with access to their electronic resources. So literally there wouldn't be any distinction between a student who is pursuing education at the parent campus in say UK or Europe. The students would be getting a similar experience. They would be having access to the electronic library or Moodle and such systems. We thought of customizing it a bit. So obviously, because we did not invest in the huge infrastructure which is required in UAE, we had a small office. But what happens to the venue? So we started splitting our courses into individual independent modules, which could be taken in independently at any given point in time. And obviously, because we were targeting adult learners, we did not want it to be um, in just one particular emirate, because if you know the UAE landscape, it is traveling from one emirate to the other is quite challenging, because it is primarily via road. uh, uh, there is a metro, but metro is only within Dubai. So if I am a learner who is based in Sharjah and I want to study in Dubai, then I will have to have my own private vehicle in order for me to pursue and go and attend to my classes. And obviously, same thing happens if I am based in Abu Dhabi. I will be most likely unwilling to travel to Dubai, because one way travel takes somewhere around 1.5 hours at least. So if you combine to and fro, it would be at least 3 hours. So all of these things we kept in mind, and we had long-term contracts with venue providers. So we are talking about five-star hotel facilities, and we started delivering these also in conference style. So there was parking available. Anyone who has visited UAE, you will also find that parking is a huge issue. So there was valet parking at all of these facilities. When you walk into a class after a working day to in the evening, you will find coffee and food laid out. So obviously, all of these things do matter to a working professional, and obviously, there is a perfect ambiance for you to study. We also ensured that the faculty members that we sourced were more industry centric. So while they do have academic rigor and they understand the delivery of concepts, but the delivery was on a much hands-on basis, where any student who is sitting in the class should not feel that I'm just listening to a theory, but how does this theory actually help me apply at my workplace when I resume office on a Sunday morning, is something that we focused on. Obviously, as I mentioned earlier, it was unlike a university where you are taking parallelly 4 to 5 subjects for a semester. Here, it was more module delivery because as an adult learner, we know their priorities. First is holding on to the job. Obviously, they have family members because we had targeted somewhere around 25 years to 35 years. That's the average age of our learners. And obviously, finally, they are ambitious. They want to grow up at their workplaces, and that's the reason why it was self-sponsored. And that's why we focused only on module delivery. So a student would learn only marketing at a time over the weekends, and then appear for marketing exam, and then probably move on to human resource management topic. We also realized that we had to provide personalized support. That's the reason why we have a very very strong team dedicated in student support. If you just permit me, I will kind of run a short video which will give you a glimpse inside my class, and you will be able to relate to what I'm talking about. Right. I am going to share my screen and the video. Please let me know if you are able to see it and also hear it a bit. Dr. Mohit, can you confirm if you are able to see the video, please?
Hello, ma'am. Video is not visible.
Okay, let me try it once again, please.
Ma'am, just audio.
Just the audio?
Yes, ma'am.
Whoops. Okay.
Ma'am, it is visible now, and audio is also there.
Right. So, as I wanted to show you, I'm sure you got an understanding as to how does a typical class looks like, right? You found that the faculty members are from different diverse nationality, and the faculty in this video is an Arab. Obviously, primarily, you also saw that our we have a very very diverse mix of students, and that's the reason why we have to ensure that we are sourcing different faculty members. Right. So this is the timeline. In 2014, we founded our organization, which was in the month of April or May. Uh, in the month of October, we had an exclusive tie up with Geneva Business School, which is a private business school in Switzerland. And obviously, we were delivering GBS programs in UAE in a customized manner to the working professionals, and they would be getting the same certificate that any student in Geneva would have got, but obviously at a fraction of cost. We started our first batch in month of December in 2014, 5 in Dubai and 7 in Abu Dhabi. In year 2016, we held our first graduation ceremony, which had about 150 graduates and their guests and families. We also have a case study published on our organization by WDI Publishing in Michigan, which studied the success story of Lincoln. In 2018, which I consider is a real big milestone for LUBM, is that we signed up with York St. John University. And if you actually find out about YSJ, York St. John University in UK, it is one of the oldest public universities in UK. It is over 175 years old, and when you tie up with a public university, they require very very stringent norms. They do very stringent quality checks to ensure that the quality that is expected by QAA, which is their federal agency in education, just like UGC, all of these criterias are met. And obviously then we had the second graduation ceremony, which we held in Atlantis, and it was attended by 600 guests. I will also run a short video about the graduation ceremony in a bit. In 2019, we had the launch of our first batch of York St. John students. We had to ensure that we are, recruiting the right learners, and we are which matches and which will be able to live up to the YSJ standards. In the first year itself, the batch visited York for a subject and obviously to conduct projects. So you will find a small picture of us in York City, wherein the students did a project. Also, in 2019, we introduced 6 different specializations. We understood the market requirements, and obviously, UAE has more demand because of ongoing oil and gas, construction-related projects. There is a huge demand for project and operations management, healthcare services, and those kind of specializations. So we sought an approval, and we are now delivering the 6 specializations in association with York St. John University. As of 2019, we have more than 2,500 students who have enrolled with us pursuing different programs. We have 85 different nationalities of students. Largely, they are coming from Arab continents, and obviously, we have Asia and Europe as well. Most of our students, they have huge work experience. There isn't a single student in our batch who does not have work experience, and the work experience ranges from 3 to 20 years. So you see, for us, kind of associating business concepts, it's not just teaching theory but also practical in application. Please allow me to run a short video um, on our graduation ceremony. Are you able to see the YouTube video?
A very warm welcome to the 2018 graduation ceremony of Geneva Business School in the UAE.
Graduates, today you have a huge responsibility. The job is not over. You have a responsibility to carry GBS as your name with you from today onwards. You're going to use GBS in your profile, in your interviews, in your resumes, everywhere.
This dream will guide your life and will result in purposeful and resolute actions.
So that was a short.
Ma'am, I just
Yes.
want to make a suggestion in the between. It's really beautiful to see the graphic videos. I'd like to request you to share something more from your experiences
Yes.
about
Yes.
the pedagogical tools that you have found effective and which we could replicate over here, especially in these COVID times, ma'am, when students are not meeting the teachers, how you are using technology as an interface. What are the patterns that we can follow?
Yes.
So, because there are loads of questions also that are waiting to be asked from you.
Sure.
So,
Yes.
I request you to share your direct learnings so
Yes.
that we may learn from you and your institution.
Certainly. So now what follows from here is about the decisions that we took in the business and how we adapted ourselves in the sudden impact of COVID, and how we changed and took certain measures so that at least we are able to sustain and proceed forward.
Ma'am, share with us how you are handling these COVID times as an educational institution.
Yes. Yes, I am coming to that. Right. So, as I was talking about this, you know, uh, there isn't any single business that would not be impacted by the changes in the environment that we all are operating in. Right. Any public university or a private firm or an individual employee, we all are impacted constantly. Some can be foreseen and some cannot be. The impact can also work in favor, just like Professor Tripathi mentioned prior, that there is a huge demand for a certain sector, and he mentioned about how pharmaceutical industries are experiencing exponential growth. So obviously, so what is the best strategy that we can use? When you look at UAE as a landscape, if you put it under the best analysis, you will find that UAE is extremely stable in terms of political environment. You will find that there are federal systems, and there are also all the seven emirates has got its unique approach towards management and policies. Yes, there are a bit of regional based tension. So you will find that there are issues with neighboring countries as well. However, UAE has very healthy trade relations globally. Economically, you will find UAE has high GDP per capita and very low unemployment rate, because obviously we are all working here in terms of the sponsorship of our organization. So obviously the unemployment rate is very low, and there is high FDI movement. Also, you will find high capital movement in this region. Socially, UAE is extremely diverse and agile. There is comfortable lifestyle, and it is one of the most modern country in the region. Technologically, I would say,
Ma'am, how is COVID treating you over there? What are the cases like?
yes, COVID has impacted UAE in today is not a day where we all work in silo, and obviously we are all connected. And have you understood one thing that has impacted, and what happened instantly is that we were all talking about globalization, and because of globalization we were connected, we were traveling intensely. But to help curb impact individually in one's country, we stopped travel. We started restricting movements. So that was first way of helping us to survive. So obviously, to survive, I feel that we have to focus. I have a small SWOT about our organization, and obviously you can have a quick look, because LinkedIn is
Ma'am, ma'am, just tell us what happened. We'd like to know from you. And then is COVID raging, or it's like medium, or is it contained? How is the status in the UAE?
uh, well, you see, whatever we learn is from the media, and it's unlike
Yes,
India where
that's right. So we are
it
lucky to have you with us, ma'am. So we're taking this opportunity to ask for your insights.
yes,
Firstly, how COVID is what is the level of spread? How is it going?
yes.
How
So
big a threat it is to the educational community?
yes. COVID definitely it has not left UAE. We are nowhere completely galvanized from it. Obviously, because there are people. Middle East has been a hub, transport hub in terms of supply chain as well. There is a huge, everything breaks down. The bulk breaks down in Middle East, and then it goes internationally, even in terms of people. Obviously, because regionally Emirates and Etihad and Qatar Airways are predominant. So that is why you will
Ma'am,
find
airlines are grounded or they are flying? Like,
airlines are grounded. However, it is right now only internal kind of a movement. So anyone who is who needs to come back, residents who need to travel wherever they are stuck globally, the flights are open only in getting the residents inside, and
in
obviously.
getting the
Can apply for if I need to travel to India because of certain emergencies, then obviously it's only on priority basis that is happening right now. Right. So
and how are the diagnostics going, ma'am? How the diagnostics going?
yes. So if you ask about diagnosis, it is pretty much Emirate wide. We were under lockdown for over 30 days, and thankfully this happened also simultaneously along with Ramadan period, where during Ramadan we all know that it is a fasting month. And obviously all of the businesses, they largely work for about half a day only, and the businesses are normally down at that time, and obviously operational hours are also low. So at that time I think government took a very good step. They ensured that the people, the citizens were not put to risk, and obviously they ensured that work from home concept was introduced. All of the schools and universities, they we were asked to go on e-learning basis, and there was a 2 week gap, which allowed all of the universities and education institutions to, uh, align what was required to prepare oneself. So, in this model, what
Ma'am,
I'm
here in India, we've been in lockdown state for almost 80 days. And
Mhm.
also, of course, we rapidly went online. But although we were all excited as academicians to explore the online medium, there are certain limitations as well. So please share your experiences about
Yes,
going online.
sure.
Are other universities and colleges functional currently over there, right now? Are the
Yes.
universities and colleges currently function? Have you resumed normal?
Yes. So that is what I'm coming to, Dr. Jyoti. If you see here, what happened, though my presentation style was from, an organization perspective, which reflected towards the industry and how we are coping, so that people can understand how each one took decision. We were asked to go under lockdown in mid of March, and obviously there was a 2 week of summer break which was pending for students. That allowed all of the universities and education institutions to kind of analyze where we are currently and what needs to be done. However, with our organization, we had already introduced e-learning because we
Okay,
cater
that
to
is
working professionals. We had made it mandatory for about 20% of the content to be delivered via smart platform like Adobe Connect, and now people are talking about Zoom. uh, and obviously this kind of disrupted the ongoing conferences, schools and universities. However, we were able to go live without any disruption, and right now even my daughter, she's studying angles, she's studying basic concepts in her grade 3 via e-learning platform. None of the universities, the pestle model which I was showing, it shows that UAE, and in the earlier question also, I know that one of the participant asked that in Assam, there is very, very
yes, yes.
low penetration of Wi-Fi and connectivity. But however, in UAE, this does not apply because literally everyone holds, a smartphone or a laptop. It is just an understood presumption. And the connectivity is also, infrastructure in UAE is one of the best that you can rely upon. So obviously, we as universities, what we went ahead and did is we adapted our content. Students, obviously, students and parents. My daughter also, as she goes to schools, there are reservations in terms of whether the quality of learning will be impacted. But
Yes.
however, if you make it more interactive, you find out ways how to engage your learners, and how to ensure that in a university setup primarily, because you have to ensure that there is more discussion based learning. Case studies are being analyzed, and they are being, what are the pros and cons of taking certain decisions, they are being taken. So obviously, instantly, all of the faculty members and our quality team and academic team, we came together. We explored how the content immediately should be changed from a classroom setup to an online delivery. There was constant training given to the faculty on how to utilize this platform, and obviously learners, the emotions are high at such times. So obviously learners are also constantly putting pressure. They are asking, they are jamming up the chat box. But we found out a way. We started introducing class etiquettes, that this is what you have to do. If there is a problem pertaining only to yourself, you are not able to hear, then you need to chat privately. We started, faculty members, we started sharing the best practices, what we learned from one another. However, this COVID also posed us an opportunity wherein we were able to, rope in faculty members from US, UK,
Yes.
Europe, which was earlier not possible, right? If they had to come over the weekends and deliver the sessions, then we had to, pay for the flight tickets. We had to ensure that they were put up in a hotel and things like this. However, because this was all happening live and online, we were able to capitalize on this situation. You can see this how the classroom was flipped. This is a live classroom. We converted one of our office room as a studio, and you can see the faculty is delivering, and also it is being recorded in high quality, and it was relayed to our students. And on the other side of the picture, you will be able to see the video as to how it was visible to a learner and how it was all managed. Now, in terms of internal adaptation, also as an organization, we had to ensure that the staff had to be met, and we had to prepare, obviously, because we are responsible for the HR as well. Being a lean organization, we instantly took decisions, and first thing what we did is we assured our team members that no matter what happens, there are no layoffs and there is no salary reduction within the organization. That gave an assurance for the team members, and obviously you need to ensure that there are no rumors going around. And team wise, we had broken down the project, and we asked each and every team to come up with their project planning as to how they are going to incorporate work from home, and how they will ensure that the work and the targets and whatever was set, objectives were set for the day, they were met. We ensured obviously that the resources were ready. Primarily, one of the advantage, what I would say, is that we provide staff accommodation to our team. So that kind of curbed, limited the disruption in communication. Most of our team members are staying in a shared accommodation, so the communication was seamless to a great extent. Team agendas were clearly laid out in the morning meetings, and we met with a checklist. And obviously, we wanted to ensure that when we met in the evening, we were motivated. We were constantly helping each other stay, above, and they were constantly being met. So, in terms of disruption, we did not face any disruption. Financial, yes, I'm sure each and every organization, we are a small and medium enterprise segment. Financial planning and discipline is extremely important. That's the reason why we took a call that even in such circumstances, there would be no fee reduction, because obviously the resources, it's a very resource hungry industry, and that was not going down. So we took a decision, and as case to case basis, obviously students were approaching us, them, and they were asking for different, those who lost their jobs or those who met with a reduction in salary, they were addressed in a different manner and on case to case basis only. Just like service industry, university has to ensure that the quality of delivery does not go down. So that's the reason why we came up with a lot of self-study materials, so that students were more independent. We ensured that there were a lot of tutorial support which was provided to students on individual basis. The university has a safety net policy in place, which allows students who are impacted because of COVID, and they, as far as they passed, they will maintain their average. For example, and that this safety net policy is now applicable across all of the universities in UK. So if I have constantly scored a 65, but because of COVID, maybe my performance in one particular subject has gone to 50, the university automatically will ensure that because of safety net policy, I would be staying in the same average of 65. In
Ma'am,
terms,
ma'am, please share with us the future skills as we go ahead beyond COVID and we think beyond COVID. What skills? You have got so much of expertise. It's been great hearing your views. So, what skills do you think students need to imbibe to survive in the industry post COVID, ma'am?
sure. Um, uh, all right. So this is a typical webinar that we constantly did in terms of marketing. So um, now these are the next steps. What I would recommend to students and to all organizations, entrepreneurs. What I feel is this is a fantastic model which I saw on Bain. Uh, and it showed that organizations that went through a recession, It had different impact on few companies, and whereas some companies they emerged much better off. And what they found is that while 89% of the organizations they fall into the black category, there were 11% of the organizations that stayed ahead, and they were much better off after any post recessionary situations. Now, what was found out is, it depends upon your preparedness. Uh, that is why it's very very crucial that one is first prepared. We need to accept the new norm. Yes, this is what it is, and let's accept it. First of all, in any change management, I'm sure you are delivering change management modules as well. For any kind of change, first of all, we need to accept that this is the reality, and it helps us in moving forward. Jobs, there will be layoffs, and we will find increasingly that the jobs are more contractual in nature. We can expect, and we are seeing it globally as well, that there are high emotions. So please do not react in panic. Mergers, acquisitions will be the way forward. Obviously, there are few companies which will be able to live, and we are seeing that a lot of companies are also closing down few units or they are shutting down completely. So that will be the way forward. We need to manage the funds much better, ensure that we make emergency fund, we invest, reduce the debt, and obviously check spending. To the students, what I would advise is, always ensure that you refine and diversify your skill sets. And these skill sets are constantly changing. The situation is constantly demanding new and different skills. So ensure that you are understanding what the industry is demanding and what lies ahead. Do trend analysis. Please read a lot, so that helps you with a lot of information, and that will help you stay ahead of the curve.
And ma'am, we've got a question from Parminder Nurula, who's been with us since the beginning of the session. And she
Mhm.
wants to know, ma'am, how are you dealing in education during COVID, a part of which you have already responded. What are you
Mhm.
following for teaching learning practices? So you have explained in detail. However, this part, has the total intake been affected? Do you foresee any drop in students from regular classes?
Yes, there are reduction in numbers. Undoubtedly, over the 3 months, we have seen that there is a drop in numbers. However, because of constant marketing activities, this is not the time that we scale back our marketing activities. We have to stay ahead in terms of recall. So that is why webinars and all are constantly conducted, and that is why it is helping us. We are seeing few after 3 months. We are started to see almost we are reaching back about 75% of our pre-COVID enrollment rates.
Ma'am, Joyce wants to know, ma'am, I want to know your insights about the pros and cons of online classes, which are now affecting the students amidst the COVID pandemic. So your
Um,
views, please.
Yes, Joyce, it is posing. I know that there has been a huge increase in online learning. It has, because of COVID, it has helped us reduce our travel times, and we are able to, because of the lockdown, it's not possible for us to go outside as well. We have got more time at disposal, and just like any warrior, he doesn't stay rested when there is no war, but he sharpens his tools so that when the war is around, he's more prepared. So, in terms of pros and cons of an online class, I feel the pros are you need to be there is high level content which is available today on all MOOC platforms. If you see Coursera, Kellogg Business School is also delivering online. It is really fantastic. However, individual learners need to have a lot of drive and discipline from within. And cons is, yes, it is not, you cannot mold it, you cannot blend it, you cannot customize it the way you want it, or to suit your ability and levels.
Ma'am, a very senior faculty member from our institute, Niti Shukla ma'am, has posted a question. online education is becoming one of the popular ways of higher education. Will this help fuel its expansion and go over the traditional classroom teaching? Do you see a flip flop happening or online taking over the
Yes.
education pattern?
Certainly, I see online the way forward, but however, I am a huge promoter of blended education. In a flipped classroom, we teach whatever the concepts need to be taught can be taken at home. When we meet in the class, it has to be more discussion and application based. There are few sectors within a university which cannot go online. Obviously, lab based, research based kind of verticals can never go engineering. It can never go online. However, it is for business, commerce, these kind of verticals or schools can easily adapt and move forward. Well, also I am a believer that regional adaptation or localization, as your theme is very very right, that while our education is global, however we need to adapt it locally. So that's the reason why faculty members need to understand Middle Eastern concepts, where students are coming from, the examples and cases that they relate to. Because suddenly, if you present an Indian brand which is known locally, and you present it to in Middle East, only few would be able to relate to it, and not. So that kind of an adaptation has to happen constantly, and that is possible only in a blended model where more than 60 to 70% of the content can go online. However, the final 30% has to be delivered on a face-to-face basis in order to drive the concept home.
There are questions galore from all over the world. And
Yes.
Jyoti Sinha wants to know that most of the students are from a rural background. Then which type of strategies will be taken by education sector considering these issues?
Um, there are students who come from a challenging background, and the challenge is not necessarily financial. However, it could be more infrastructure wise. The strategy in such scenarios has to be, penetration. And as Professor Tripathi also mentioned, that infrastructure is the way forward. Investing in infrastructure has to go on constantly, be it pandemic or non-pandemic situation. So there has to be, but depends upon any school. If I am a school catering to a rural area or a town kind of an area, I will always ensure that it is aligned, because aspirations from from these places are pretty high. So you need to ensure that the standards are high. You give them more work. You ensure that the international standards are met. Maybe I have seen that they have the most fantastic minds. However, what they lack is in terms of communication and finishing skills. So you have to constantly ensure that the students from these areas match a national or global level.
Ma'am, do you think that in future most of the jobs are going to be in the area of tech only? Because technology is going to be taking over all our life functions very majorly. So do you think non-tech people have got chances with jobs? Like, do you think this kind of a disbalance can happen?
I do not deny that it will be tech based. However, I feel there will be a lot of jobs which will demand a lot of human based skill. So counseling, any person who is high on EQ will also be constantly in demand, because even though we have got remote teams working from different places, how do we always ensure that there is a perfect blend and understanding amongst the team dynamics is something that will be required. So I do not feel. Yes, there are a lot of jobs which are very repetitive in nature. Chat boxes are being taken over by robots, and that's the reason why you will find a standard type of a message being constantly delivered. So yes, those kind of skills we need to identify. Every student needs to identify where they are and what kind of skills are required in future.
So, ma'am, you've got like I'm really impressed by the way you're just handling so many diverse questions, and in the fraction of a second you just come up. So that just shows that you've been really been working long in this area and your rich experience in this area. And I'm happy to welcome Dr. Mohit Verma, Dean of Management, onto the forum. And I'm sure he'd like to pose a few questions to you and discuss things further.
Yes, Meghabi. I just wanted to know. I have seen in my at my home also, my kids are taking online classes, and it happens off and on that they don't take it seriously because they know that nobody is there face to face to held on for such issue. So once we look at the UG or PG level students, uh, how what do you say about it? I mean, in days to come, especially when we are focusing more on online education.
Yes, Dr. Mohit, it is a very nice question that you have asked, and that is the reason why in education sector we will see that at UG level there is a far more control, and at PG levels, there is a lot of expectations that the drive will come from the individual themselves. They are supposed to be much more, self. Reliant or independent in that way. So I think the drive is from within. It depends upon what ultimately I know if this is going to add value to my own vertical and this is for my own betterment, then that is going to be the driver. Ultimately, kids, yes, we need to push. You rightly mentioned at lower levels there has to be a control mechanism wherein is you don't need to constantly helicopter the student and ensure that they are studying, they're constantly monitoring because they get used to it. However, random checks and ensuring that they are attaining the standards that are expected has to be constantly checked.
Okay. Yes. Over to Dr. Jyoti, please.
Sorry, sir. Ma'am, I'd now like to invite Dr. Rinki uh, and propose the vote of thanks. We've taken up a lot of your time. You have been indeed very generous with your knowledge and your time. We are fortunate to have you with us. And I'd like to invite Dr. Rinki Verma from the Institute of Management, Commerce and Economics to propose the vote of thanks.
Thank you so much, ma'am. Good
Thank
afternoon.
you. Good afternoon.
Good afternoon. Good afternoon to the eminent speaker of the day, respected Dean, Institute of Management, Commerce and
Your video.
Economics.
Would you like to
Sorry,
switch on
ma'am?
your video? Would you
Yes,
like to
ma'am.
switch on your video?
It
You are
is
not
on.
The
visible.
video is not working.
No.
It is not working.
Just
Let me
no,
check, ma'am.
just operationalize your camera.
अनुश्री वीडियो आ रहा है?
So, ma'am, while we wait, I think we shouldn't lose precious moments with you and keep on learning. We are all here in India. We were just rudely cut off. The educational institutions were cut off very suddenly on the 15th of March, and since then, millions of students have been at home. And there was not much time for faculty to orient. So, I'd really like to appreciate the entire faculty community who have at home learned the new tricks of teaching online and online practices, best practices. The institutions have also come forward in training, but everything has happened from home. So I'd like to take this moment to appreciate the entire faculty community and the institutions which have helped them to transit so fast. I think Rinki has joined us, and I'd like to invite her to say the vote of thanks. Your mic.
Dr. Rinki, your microphone. Yes.
Your mic.
My apologies for the technical issues. Am I audible now?
Yes.
Yeah,
Yes,
you are
yes.
audible. Carry on.
Thank you. Good afternoon to the eminent speaker of the day, respected Dean, Institute of Management, Commerce and Economics, directors and deans of the various institutes of SREU, and my dear viewers. On behalf of the Institute of Management, Commerce and Economics, I would like to thank our eminent speaker of the day to second session of international webinar, Ms. Meghavi Banerjee from Lincoln University of Business and Management UAE, who very aptly took the case of her university for discussing the need and importance of learning and education in today's scenario. Ma'am very precisely pointed the requirement of broad coalition of international institute, universities, and development agencies to expand and improve education for all. She mentioned that how learning is going to be the future for education. The educational institute alliances will with international competent teachers can offer courses that suits the curriculum of the students across the globe. So reputed universities and institutes can offer online and offline courses that fits into the curriculum. This is the right time to strengthen online and offline education to be prepared for any future pandemic situations. The entire education system has to undergo changes with the active involvement of faculty and institute and from foreign universities. It should now go global and be part of the international education system. The strength of the system lies in the faculty that an institute needs to nurture. Faculty and also the faculty need to change their mundane teaching methodologies and adopt to evolving technology centered teaching. I'm sure that her deliberations have surely paved thought provoking ideas to our students, academicians, researchers, and industry representatives. I'm very thankful to you, ma'am, for your valuable contribution in the webinar. Thanks to all. Thanks to everyone. Over to you, Jyoti, ma'am.
And we do hope for future opportunities of connecting with you, of inviting you, in streaming you into our campus, and the students also learning from you in person and online. Thank you so much for your precious time and
My
thoughts.
pleasure. Thank you very much. It was my pleasure to be a part of this international webinar hosted by SRMU and the college. However, my personal insight was that, obviously I have been involved right from founding of this organization, and that is what I wanted to share with my, people who were visiting and who were attending to understand the journey of the organization right from the setup, how we constantly kept on customizing, and so that they know that these are integral parts for them to stay ahead. And I hope from my experience it would have benefited a few of them, and they will be able to go the entrepreneurial way when it is the right time. All the very best.
Thank you so
Thank you.
much.
Thank you.
Thank
Thank
you.
you so much. Thanks, Meghavi.
So after a power packed day today, we've had a great session, two great speakers, lots of thoughts, lots of questions, discussions, dialogues, queries. We did take up as many questions as we could, and but for those whose questions we couldn't take, we still have all of tomorrow to go. Two power pack sessions tomorrow. The first one being addressed by Mr. Tarun Kalra, Head of Global Sales at Credo Labs from Singapore. He will be talking about the looming threat of deglobalization in a post-pandemic era at 11:05 tomorrow morning. So please stay tuned in. The second session tomorrow is going to be the new normal at work post COVID-19 scenario at 12:05. We have Ms. Nidhi Chaudhary, who is from head of global sales. She is head of global HR at DuPont, and she will be taking you into a journey how the US is getting back to work. She will be sharing best practices post COVID, how they are staggering the workforce, how they are. Some of them are adapting work from home. Some of them are going out. How the choices are being made, how the organizations are reorganizing themselves, and of course, both our experts will be available for Q&A and lots of ideas to be exchanged and lots of courage to be developed so we can go forward powerfully into the post-COVID area as the lockdown opens up. Sir, any last comments from you, Dr. Mohit Verma? And then we can
Women,
close.
It's okay, ma'am. We look forward for tomorrow for the eminent
Yes,
speakers.
yes. And Nikki ma'am, since you made your online debut, we hope to see
Yes,
you
ma'am.
online tomorrow as well. Happy to have you with us here. Thank you very much. Thank you to all our viewers, faculty, students, and all the people across the globe who are watching us. Thank you very much.
Thank you.